Well, so we have to go to the northern region, Mamavi.
Yes, we do. This is a home story, really. Midwives at the Good Shepherd Health Center at Tuna in the northern region have now resorted to the use of torchlights and lights from their mobile phones to deliver babies at the health center. Remember, we experienced this when we had the Doomkra situation. But this is as a result of a rainstorm that ripped off the roof of the facility, cutting power supply to parts of the hospital. Joy News' correspondent Rafiq Salam, who visited the facility, reports that the situation has forced pregnant women to deliver at the home or at home rather than use the facility, which has resulted in complications for them after delivery.
It's been close to 3 months since the Good Shepherd Health Center, located at Tuna in the northern region, had its roof ripped off by a rainstorm. The hardest hit area was the laboratory and the labor ward. The laboratory has since been moved to a different location, but in a much smaller space. However, the labor ward still remains same. The zinc still leaks, and women in labor are crammed at the chemical meant for deliveries. With the onset of the rains, midwives here have a dual role of taking care of their clients and also sweep the water that usually flood the ward.
Last one had more than 30. This one, because of the rain, they don't want to come. So we have.
Juliana Yelviene Bayire is the midwife in charge of the labor ward.
Especially when it rains, the nurses or the midwives here, we cannot be here to monitor the women to deliver. We have to go home because of the rain, because we are afraid that the building may collapse on us. And even the laboring women, they also fear. They are also afraid that the rain can also fall and that the ceilings or the zinc can collapse on them. So it affects the maternal death. As we are saying they should come, we are encouraging the women to come and deliver at the facility. But because of this problem we are having here, they will not come. They will force to deliver at home. And maternal death can occur. The monitoring they need at the facility, they may not get it at home. So it won't be easy. It will really affect maternal death.
Power supply to the labor ward has been cut off since the incident occurred. The situation has forced midwives at the labor ward to use such lights and lights from their mobile phones to deliver the babies.
When there's no light, sometimes we use our phone lights too. And for that matter, we need somebody to assist. Sometimes we use this chargeable lamp. And sometimes too, when there's no lights, in the labor room especially, we use this one to buy battery inside. And sometimes we are forced to ask the patient relative to help us with the battery if we don't have money. Sometimes if the patient cannot afford, we, the midwives or the nurses, we have to buy the light, the battery and put so that we can help the woman deliver.
Pregnant women who attend antenatal care at the clinic and are due for labor next month are frightened about the state of the facility. Haba Hen is one of them, and she hails from Suomu, a community which is 15 kilometers away from the clinic.
I am here for antenatal care, but already frightened about the dilapidated structure. If it started to rain now, I can't sit here. I'll be forced to go to my community, which is also far away from here. You can imagine a pregnant woman in the rain. My appeal to the government is to fix the leaking roof so that whenever it rains, we can still be treated here.
The Disease Control Office of the Sub-District located at the facility was also not spared by the rainstorm. Officer in charge of the disease control unit, Jonas Atibela, told me vital drugs and documents kept at the office were destroyed by the rainstorm.
It affected our sockets, and most of them are blown, and because of that, the fridges are also affected. And all vaccines that were kept in the fridge were all destroyed, so we have to discard them. We are so much inconvenient because this feed, for instance, is not supposed to have been kept here. It's supposed to have been kept at the stores, but which is not completed. You can look at the ceiling here. Whenever it rains, this place becomes a flooded area.
Due to its strategic location, the Good Shepherd Clinic is the preferred choice of clients in the district and beyond. It serves a projected client population of 37,000. Administrator of the clinic, Augustine Luke Titiwe noted that the number of OPD attendants to the facility has reduced drastically since the rainstorm, and appealed to the government and other benevolent organizations to come to their aid.
We usually get an average of 30 women delivering at the facility, but this last month, in a month we should get about 30. Now we have roughly 21 clients coming in for delivery, and we are supposed to detain the clients for at least 24 hours for observation after the delivery. But because of the storm nature that has affected the maternity area, clients will have to be discharged immediately, and it has medical implications for that purposes.
There are several dozens of clients who are in the facility and outside the facility waiting with bated breath for their turn, and they have only one hope and prayer, and that it shouldn't rain, so that they will be attended to by the facility. Reporting for Joy News, Rafiq Salam, Tuna.
And we worry because this rainstorm was some 7 days ago. And if you check reports today, ordinary relief items for people, for individuals, have not even reached them. Now, you look at this facility that's serving this huge purpose, with pregnant women waiting to be delivered of their babies and having to go through this, with nurses complaining about the condition. And then you're thinking, when will they also get some relief? We're built to speak to Thomas Bebe, who is the Director of Health in the Northern Region. He had agreed to speak to us, but now we can't get through to his phone. So, you know, when we do have him, because we want to know what is the health directorate down there role and doing about this situation. And it's because it serves about 37 communities, really.
And the communities we're even talking about are sparsely apart.
Yeah.
They're sparse. So it means that you get one community, and I'm sure the next community will be around 18 kilometers.
Yeah.
Or could be half of that. And you know that they have to trek several hours because you wouldn't availably have a vehicle or even a motorbike that usually
to carry them to the facility.
And more so, they can't even afford drugs that will not be available at the center, even if they are on national health insurance cards. So it's something I believe that we also need to take seriously and say, if we're health directorates in particular districts or metropolitan areas, we need to make sure we reach out to the people.
Exactly.
We have to be more curative than more preventive than curative.
Yeah, I agree. But this may also be beyond the health directorates down there in the Northern Region.
Just also because they don't have the resources.
We agree. Yeah, this may be way beyond them. But just, you know, come out and speak to us because this is a place in Tumu and we know the purpose that it serves. We'll be hitting on the subjects, but we've got to take a breather here.